Welcome to the Land and Lead podcast, where we explore the real stories behind leadership transitions, the setbacks, strategies, wins, and moments of growth, all aimed at helping other leaders land well and lead effectively. I'm your host, Dr. Josh Elmore of Court Street Consulting. Today we're speaking with Dr. Paari Gopalakrishnan, President and CEO of GBMC HealthCare. Dr. Gopalakrishnan leads Baltimore County's only independent community health system. Known for a leadership style grounded in transparency, accountability, and compassion, he stepped into the role in September 2025, uniquely prepared to guide GBMC's next era of strategic growth and community impact. Dr. Gopalakrishnan brings more than 2 decades of clinical and executive experience, shaped most recently by his tenure as President and Chief Operating Officer at Kent Hospital, a 359-bed community teaching hospital in Rhode Island. There, he launched the state's first hospital at-home program, expanded access to geriatric and specialty care, led the state's COVID-19 field hospital, and oversaw a dramatic financial turnaround that moved the hospital from deficit to surplus between fiscal year 2022 and fiscal year 2024. His system-level leadership extended across centralized medical staff services and a Medicare and Medicaid certified home health and hospice agency serving more than 160 employees. Since arriving at GBMC, Dr. Gopalakrishnan has begun shaping the organization's future with a deeply personal leadership approach that emphasizes visibility and trust. His early initiatives, including relocating the executive huddle board into a public hallway and launching a comprehensive senior leadership pledge, reflect his commitment to transparency, approachability, and shared accountability. Through his weekly Better Together blog, he reinforces these values, offering candid reflection on leadership, cultural alignment, and the responsibility of earning trust. Looking ahead, his vision centers on expanding access, advancing clinical integration, and ensuring GBMC continues providing the care we would want for our own loved ones. Welcome to the show, Dr. Gopalakrishnan. Can I call you Paari?
Of course you can. Thanks for having me. I really appreciate it.
Yeah, certainly. We're excited to chat about your story, and kind of from there, can you share a little bit about your background and how you landed at GBMC HealthCare?
Sure. I'm a hospitalist by training, physician, and kind of fell into leadership, I would say a little backwards, in the sense that I had no intent of going into leadership and thinking I'd be in a role like this. But what really happened for me was I started as a hospitalist very early in the hospitalist movement. And because of that, our practice grew really fast. And within 3 to 4 years of our group starting and growing, we had many doctors and a lot of growing pains. And so to help my practice and be able to operate more efficiently, I started getting involved in leadership and process improvement. And that led myself into an MBA program that the organization I was part of put us through, and just taught me how to think and approach leadership in a very different light. And as I started doing that, I got this, I felt this value of when I used to take care of patients. I would see 15 patients or 20 patients a day as a hospitalist. But as I started getting involved in process improvement and leadership and organizing our group, I was now influencing more than the care of 100, 150 patients. And that's how my career kind of started in leadership. And that feeling of value as I went into other leadership roles, overseeing larger hospitalist groups or a chief medical officer and so forth, just felt like I was making more of a meaningful impact in the community I was serving. And so that was really rewarding to me. And it's something that my parents had instilled in us when we were very young, which is really about the impact you make in the world. And it really has started to resonate with me. And that's kind of how I kind of went down this leadership path, and, have found myself at GBMC HealthCare as their CEO, which I'm thoroughly enjoying.
You mentioned this word hospitalist. Can you explain what that term is?
Absolutely. So when somebody gets admitted to the hospital, when a patient comes through our emergency room or gets admitted to a hospital, I would say 30 years ago, their general practitioner or their primary care doctor would see that patient there in the hospital, take care of them until they're discharged. And that doctor would come into the hospital, make rounds in the morning, see their patients, go back to the office, see their outpatients, and that's how it operated. Sometime in the, I would say, late 90s, this term hospitalist came into where the specialty is literally focused only on the hospitalized patients. And so these practices grew where the hospitalist focus is only on the acutely ill patients that require hospitalizations. And that field has exploded over the last 20 years. And I would say almost virtually almost every hospital either has a large hospitalist program or they're the only provider of inpatient services in a hospital.
Wow. Okay. So hospitalist is specialty and acute care.
Perfect.
Okay. And so being specialty, being acute care, that, right, the word itself, specialty, and you have this journey going from that to MBA to impact across full organizations,
Yeah.
systems,
Yeah.
right, hospital systems.
Absolutely.
So that contrast, right, it sounds like it was a big one.
Absolutely. One of the things you get to see as a practicing hospitalist is all the things that work well, but
Mhm.
you also see all the dysfunction between different departments around communication and collaboration and how processes are, how you can get bottlenecks and barriers. And so it really makes you understand those kind of processes. At least it did for me.
Certainly, yeah. I mean, getting that systems perspective allows you to kind of see maybe when you were in the hospitalist role, what things may have been, where the tensions that you felt, but maybe couldn't put your finger on.
Yeah.
Then you can say, okay, that's what's happening.
Right, exactly. And then you learn, at least in those days, leadership's very much about influence and not about control. And so you learn to, when you didn't have the authority but saw these bottlenecks to kind of work with the other group, the areas where you're seeing this bottleneck to see what is the win-win that actually helps both of us be able to move patients through or processes through.
Wow, very cool. So we're thinking about kind of your journey from being a hospitalist to getting some professional training around your MBA and then moving into these leadership positions. So you entered GBMC September 2025. Can you tell us about the circumstances as you entered the organization?
So when GBMC HealthCare was looking for their next CEO, they did a national search, and the GBMC's had a history of longevity in their CEO position. I was going to replace Dr. Chisar, who had been here 15 years, and I was the fourth CEO of the system. So they've had long tenure in their CEOs, and that was one of the things that attracted me. Is what it was clear to me was the board was looking for a good fit, but a long-term fit. And that was really impactful for them. That was a big value for them. And that interested me quite a bit. The other about GBMC Healthcare was it's one of probably less than 40 health systems and hospitals in the country that has gone through a Baldrige application and been awarded the Baldrige Award, and which happened about 4 or 5 years ago. And so those two things were the primary drivers for me to say, I'd be interested to explore this opportunity, because you have a board that's really looking for fit and long-term success, and an organization from the top level thinking about organizational excellence and workforce engagement. So those two things were the things that items that made me interested into learning about GBMC. So as I learned from afar during my interview process, you're doing a lot of due diligence. At least I was. Is this something I want to pursue if given the opportunity? Because I was in a place that I loved. I loved the people. I had started building it in a way that I liked. I had my team. We were starting to see success financially. We had done a turnaround, and everything about it I loved. And so I wasn't really actively looking to leave. But when this opportunity came, those two aspects that I talked about made it intriguing enough for me to kind of explore the process. And as I explored it, I got more and more excited about it.
And the Baldrige Award, can you explain that?
Yeah, it's a presidential award that is given to. It's not a healthcare award. It's given to businesses. It's around a couple of disciplines, really: organizational leadership, culture, operational excellence, and how do you engage your workforce to do those. It's a really rigorous process to be able to go through and put processes and policies in place to make sure you achieve it. And it's more of a journey than an award, in the sense that organizations use the templates and the criteria to work through it, and it takes several years to be able to get to where you are. And so it just, to me, it just highlighted the importance and the value this organization puts into excellence and their workforce, which are two things that have been tenets of what I think are really important. So that's what intrigued me about joining this organization.
Okay. And so the organization has a history of having long tenured CEOs. They were looking for that in their next CEO.
Yeah.
And as you were obviously, you chose to join, and as you were coming in, what was the situation?
Yeah, situation, again, a couple of things that were challenging in the sense that, so one is a 15-year CEO who's well revered, well respected, well liked. That's awesome. That actually is not something I was concerned. That was refreshing for me. The other was, the pride of the community in the system of GBMC is like, medicine is a really small place. And though I was in Rhode Island making a few phone calls to physician colleagues that I know in the region, it was very clear that the medical community respects this organization. That was two things. The big challenge that was here as I was coming in, kind of twofold. Operationally, financially, there's some challenges that we know we have to improve upon. So that's one of the things that's there, and it's one of the things that I was able to achieve at my last place to help kind of shepherd the organization to profitability. The other is the landscape of health policy in Maryland is different than the rest of the states, and there was some ambiguity and some shift in that happening with health policy, and all around the time that I was coming in. So the things that as I was entering the organization is trying to understand operationally, how do we position ourselves to be financially viable over the long term? What are the levers? Trying to understand as much as I could from afar. And the second is, the health policy of how hospitals get reimbursed in Maryland is historically been different than the rest of the country, and the sands were shifting. And it hadn't set yet. And so trying to understand those two things were really front of mind. And for me, one thing I kept saying is I don't want the fact that I'm a new CEO into a new region to be a reason the organization has to suffer around something like that. So I have to spend more of my time to really get the knowledge base so that I could make sure that my onboarding doesn't impact us for long term. And so that was really front of mind for me because that sometimes I've had other jobs where you think about the first 90 days and it's all about listening and your focus and that is the most important thing. But there are some pressure points which usually, every leader knows even in those 90 days you're addressing. It just so happened that this pressure point was a macro level pressure point on economics that I had to get some deep understanding and relationships for.
Yeah. And so, so you have kind of this external pressure to accelerate your learning while simultaneously maybe, get your lay of the land as you entered and give yourself time for that. Maybe there's some things that were more time sensitive, some things that were allowed you to take a, slower or a measured approach as you entered. Thinking about the strategies that you used across these kind of more time sensitive dimensions, areas that you could take your time on, what strategies have helped you kind of come in and get on board?
I tell my kids this all the time, fail to prepare, prepare to fail. That's like something that I always say to them. And I used my time before I came. I prepped a lot and got ready for this role. And I asked a lot of questions from mentors and other people that had roles like this. I read as much as I could find. And so a couple of things that I did in retrospect really has helped me. I didn't realize the impact, the amount it would help me as I was putting my onboarding together. I went through and thought through my first year, first 90 days, here are the things that I wanted, the processes that I'm going to do, and here are some of the deliverables for myself. 120 days at 6 months and at a year, high level, really put down, and each of those areas put down key deliverables that I want to hold myself accountable to. And I made sure I shared that with the board before I arrived so they could give me some feedback and I could refine that. That helped at least set a roadmap for the first year for myself, but also made sure that my board was aligned with that roadmap. That helped quite a bit. The second thing I did, and this one is helped me the most, is recognizing that I needed to come up to speed really quickly. And listening is the most important part. And the fact that, in 90 days, I needed to really gather as much as I can while the sands are shifting underneath us. One thing I did was I created various stakeholders. So our board, all our executives, our physician leaders, and our nursing leaders. I created, I wrote a letter to each of them separately. Saying, I'm all about listening and here's my leadership style, but I'm going to ask you, 20 questions and give me it's a quick survey, should take you more than 10 minutes. And then I offered to them, do a SWOT analysis for the organization. And what I actually expected, I asked my executives, they had to do it. I said, get this to me by the time I get there. And then the physician leaders, the nursing leaders, and the executives, I basically said, I've asked this of our executives. Please, if you want to, you're welcome to do it as well. Yep. I had about 40 SWOTs at high levels before I got here.
Wow.
And so using this, and you ask for something, you're like, wow, I didn't realize that I knew what I asked for, because I got the most enriched information possible. So before I arrived, I had a really much better understanding of what my executives, physician leaders, nursing leaders, and our executives, and our board members thought about strengths and the weaknesses and the opportunities and threats. And I asked some really pointed survey questions to get a better understanding of where I should put my focuses, how collaboration, communication, how things had worked in the past, things like that. It gave me a big head start, but then I used that as I arrived. I met with each of those people individually for an hour, and it was rough in the sense that time consuming is I'm meeting an hour with them and using this information that they've given me to really point our conversation. And so in my opinion, it made me be able to accelerate my knowledge base of what's happening within the organization and my leaders and my board members' thoughts of external factors as well. So that's helped me quite a bit shift into this organization sooner than I thought possible.
And so super powerful practice, getting insight, such rich picture of the organization before you enter. With the board, you're seeking alignment on that year-long plan, and now you're working with those folks who you got feedback from. To what extent has all of that listening, that kind of rich picture, informed, prior to today, but even today, how you work with the board, how you set expectations with the board, how you work with all the other stakeholders who gave you that feedback?
Yeah, it's, we'll talk about the board and first. I was the president and chief operating officer of a hospital in a system before I came here. So I never had my own board to manage with, right? And so that I took very seriously, trying to understand what is going to be my strategy and my style to work with our board, which is a large board, a very dedicated, but 25 plus board. And so what are my strategies? And I consumed a lot of information before I came, looking at some of the McKinsey reports and other on how what are best practices. AHA has some stuff, so I consumed a lot of that as well. My questions to our board essentially was on that survey was very pointed to what was working well and what wasn't, right? And what they thought there were some key themes that came out of that. They want to be more involved in how we come up with strategy rather than being told at the last minute. That's how I'm exaggerating, but they want to be a partner in some of these things. And there were some things around where they felt that they were getting a lot more data than they needed, but they needed more information. So it helped me point, how do I navigate some of these things? And so I've been consciously working on those things with our board chair, and we're working through our, how do we make the board meetings more meaningful for everyone? And so it's a work in progress. But they've been super supportive of what we're trying to do. And I'm transparent to a fault. Like at the end of the day, I want the same things as our board, and I want the same thing as our organization, best for our organization. So and we're all dealing with really complex problems, and so in those complex problems, there isn't usually a right and wrong, and so you need to sit and really make sure you're on the same page on a lot of things, but with that, you need some healthy dialogue.
Certainly, yeah, and so just kind of keeping with the board real quick.
Yeah.
They've been working with the same leader for 15 years.
Yeah.
Right? And did your predecessor stay on the board?
He didn't. He's local, but he and I have a good relationship. We actually meet for breakfast, and he's helped mentor me. But he's also been very clear. I'm not going to come and get in the. I've been very impressed with how he's put some boundaries himself. I didn't ask for it. He did it himself, but is there for phone a friend very quickly.
That's great. Yeah, I just wrote an article about predecessors staying on his chair. Focusing on the Warren Buffett, Berkshire Hathaway, Greg Abel incredible story and the challenges that come with that. So, and then thinking about the stakeholders, right, that gave you that data, the SWOT analysis, the survey data, how has that helped your listening prior?
Yeah, it's helped a lot in the sense that, it established my approach with them pretty easily, right? So then I was able to bring so for the physician leaders, for example, I took all the physician leader SWOTs, combined them into one, and shared that at the chairman's meeting and various physician leader meetings. Did the same thing for the nursing leaders and did the same thing for the executives. But I think what the most powerful was bringing all of those together and to say, you guys aren't actually that different. You have similar thoughts on our strengths and similar thoughts on our weaknesses and similar thoughts on opportunities. And so it just tells us that once we decide how we want to align to move this organization, we're all on the same page here.
And that can be a powerful force.
Yeah.
Once you get everybody moving in the same direction.
Yeah, exactly. We haven't picked a direction in many areas yet, but it's early.
Yeah. And right. So September 2025, 4 or 5 months in.
Yeah. Exactly.
Okay. And so thinking about that short period of time, what are some wins or setbacks and how do they manifest?
So I'd say the wins have been, I feel like I'm earning trust the way I think that feels good to me where we are. Some of the wins are getting the organization structure in the reorganized in the way that I think will make us effective long term. I had initially intended that to be about a 6-month process. Because of how we onboarded, it helped us get to that spot, right after the new year. I think those are some of the wins that we've been able to. And then I think one of the wins is just the message of understanding two things about my leadership for our entire system. One is very data driven. So we need to get much more refined on our data and how we approach it. And the other is being approachable and transparent is something that I think I've really, in 4 months, been able to really start instilling. That people recognize that my leadership and my team's leadership is going to be all about the fact that we don't know all the answer. We don't expect that, we're not going to deliver a plan and say, follow this, that we truly expect a two-way conversation and we truly expect to kind of navigate this together.
And right, 4 months, not a lot of time, but any setbacks in that period?
Some of the setbacks are, you plan, certain things and they don't go the way you want it to. Like, from personnel perspective, that's one, you're paying attention to your finances, but you're not actually making any impact on changes, right? And so paying attention to those things, and I'd say, I wouldn't call it a setback, but I think in the first 4 months that you're doing all these things, but you haven't actually tangibly started moving down operations of changing things. So I wouldn't say any real setbacks in 4 months. I think it's kind of the honeymoon period in some ways, right? You're learning a lot. There's a lot of excitement. And so I wouldn't say any major setbacks. I'd say the only, I wouldn't call it a setback in the sense that the health policy landscape in Maryland has settled more and has gotten a little clearer. So that helps us now. At least we understand more where the next 10 years are going to look like. Not quite settled, but getting there. And so that's helped in that sense.
Yeah. And what it sounds like, and these what you're mentioning, they can feel like setbacks, but I call them in organization development terms, or any time you try something or do something new, you have to kind of learn and see what happens. And sometimes when you do something, it doesn't have the intended effect, or it can, the downstream effect takes longer, to your point. Sometimes it's always important to reflect on those moments of, I did this thing. Is it working? Is it not? Let me give it time. And given what you've learned, how do you pivot and address that?
Right. Exactly.
Makes sense, especially 4 months in.
Yeah.
And so I asked this question of all my guests. I know it's going to be very different for you. It sounds like, because you're 4 months in, but I'd love to know what it feels like at this stage. Thinking about in the 1980s, John Gabbro ran a few studies focused on general managers and presidents as they pursued new roles and wrote the results up in the book, The Dynamics of Taking Charge. Gabbro explained that an executive has fully taken charge when they have mastered the new assignment in sufficient depth to be managing the organization as efficiently as the resources, constraints, and the manager's own ability allow.
Yeah.
Thinking about this definition where 100% is having fully taken charge in your new assignment, what percent would you say you are at now?
Yeah, I mean, I think maybe I'll give you 2 scores then.
Yeah.
One is I think I've in 4+ months have at least laid some organizational framework about how we are going to operate. Meaning, different processes, how we're tracking data, what are the frameworks of how that comes. I feel like I'm where I thought I'd be in that regard. As far as truly taking charge, knowing all the metrics and starting to turn things, I'm at like 30%. We have ways to go, but I feel like we've, with how we've restructured the organization, set up various committees and policies, and how the information kind of feeds into the organization. So we know where the challenge, that we have a awareness as an executive team of the bigger issues that we can make those decisions together. I think I've set that framework up where I feel really good about where we are 4.5 months in that framework.
Yep.
And then now we just have to execute on these things, and it's going to take some time.
Yeah. And I appreciate the answer because it's a hard one to answer 4 months in. And so thinking, right, a lot of the focus is forward, which makes sense, right? Because starting things out, laying the foundation, you have things kind of put in place. And as we're having this conversation, and as you've been thinking about that future focus, you've got your foundation set, you're looking towards that, right, beyond 30%, what are you looking towards that's exciting for you and you just can't wait to dig into as a leader?
It's our strategy. I mean, I think there's 2 aspects of our job, right? Like the one part of my job and my team's job is to make sure we're operating efficiently and making sure we're making good use of the resources. And because the healthcare dollar needs to stretch appropriately. And so that's one part of our job. And we have to do that. It doesn't matter what the health policy is. It doesn't matter where you got to run your business, what that is. And that's not as fun for me as the strategy portion of where we want to be. What do we want to be when we grow up is how I keep saying it. I mean, we're a 60-year-old organization, but in this time as an independent health system that has a good reputation, we're not a huge system and we're not a small system. But we're a system in which we got to pick and choose what strategies and where we want to be. And that's what I'm starting to focus ourselves on. That's the second part of this year is a strategic planning initiative that we've kicked off. What I'd like to get to by the end of, in the next 6 months is how do we deliver the care we want to deliver? Like the way we deliver it. Where do we want to be when we deliver the care? Meaning, obviously, we're a big, our health system's in one spot, and we have a couple of satellites. But is there other parts of this community that we should be in, geography-wise, that best for our patients? And then, what are the service lines? What do we want to be? What type of services do we want to be providing? We can't provide everything and do it well. We got to pick and choose. And that's what we're working through now. And that's really exciting because that's going to lay the foundation and framework for our organization to say, here is where we're going. And then we got to execute appropriately. And so when we get there, I'm really excited about that.
And I hear, right, so at the beginning of our conversation, you mentioned the hospitalist, right? Like the kind of focus areas. And when I talk to leaders and all of what the research says is when a leader comes in, they have things that they address that they're oriented towards, right? Like how do we, so obviously with the MBA, with like that systems perspective, you're coming in and kind of getting that full lay of the land and taking a picture. I saw one of your pillars for strategy around like, what is it that we actually do? Does that come from your hospitalist background?
I think so. I think it's intentionality. I think as a leader, I pride myself on being intentional in everything I'm trying to do. And not that I'm perfect, not that I'm not intentional at times, but I got to rebalance myself on what is intentionally do we want to spend resources here? Intentionally do we want to do this? And that's when then you can really use limited resources to get to where you need to. And it comes probably from my, I was a engineering major for probably 3 years of my undergrad before I decided to go to med school. So it comes from that. So I'm very intentional in how I lead.
Yeah. And, also where you focus and what you have perspective on from the past, you also can know what good looks like.
Right.
So thinking about, as we wrap up here, what advice would you share with leaders currently entering a new high stakes role?
I would say, you're going to have a little bit of an imposter syndrome. If you don't, there's a problem. If it's the first time you're taking on a role like this, recognize that you have to rely on the strengths that brought you here, but also recognize there's a lot more that you need to grow in. You see one organization. And so I say a lot, there's 10 ways to do this. I get it. So I just need to understand more. So listening is probably the most important thing. Getting as much advice as you can, either from reading, literature, and people, is really important. I think that what I feel I'm really proud of is without my preparation to start this job, I'm really proud of it, because I think I set myself and the organization up in the best possible stance because of that, which is reading a lot of stuff, talking to other people that had these jobs, that had been doing the jobs for a while, but also who had just entered in the last few years to see what are things that they would have done differently, and really being open-minded about getting feedback. And not coming in a way that, like, here's my 10-point plan to fix X, Y, and Z. I think those are the advice I'd give. And I think that's same advice to any role you take. It's not, and there are big, from a CEO perspective, I also, I think you should think about your gaps that you don't have in the role you had before, right? So if you're going CEO to CEO, you likely understand all of those things. But there were big gaps that I didn't have to do in my previous role, right? So philanthropy, I was part of philanthropy, but I wasn't the main person of philanthropy for our organization. And then that's a big job of the CEO, to work with the philanthropy team to make sure that, and so that's something I have to get advice and rely on my team on how best to do it, and not feel like I have the answers or not fade away. That's an important part of the job that I have to grow in. There's the board management. I presented in front of boards many times. I've had interactions with my board members, but I didn't report to the board. And so that relationship, so those kind of things, understand your gaps, come up with strategies. Don't get fixed on, just because you think this is your strategy, don't, say this has got to be it. You got to be willing to pivot a little bit.
Yeah, I mean, and it makes sense. There's a great HBR article, 7 Surprises of a New CEO.
Yeah.
And one of the surprises is how much external focus you have to have, right?
Yes.
To your point around philanthropy, right? Being the spokesperson for the organization.
Yeah.
So makes sense. Great advice. So thanks for joining us, Paari. And is there anything you'd like to share that's coming up for you or GBMC HealthCare?
Yeah, for us, I'm really excited about the next year. So, we have 3 arms of our organization. One of them is Gilchrist, which is the largest hospice provider in the region, in the state. And they recently won the Circle of Advocates award this past summer, which only 2 hospices in the country won. But they're partnering with another health system in Virginia and starting a joint venture. So we're growing there. So I'm really excited about that aspect of it. And then the other is from our main hospital perspective. We are taking a very transparent approach to data. So we started, having all of our senior team huddles outside in the hallway with all of our metrics, including patient comments there. I'm really excited about that, because I'm trying to make sure that the entire community recognizes we're about taking care of our patients as safe as possible, and we're not going to hide from anything.
Yeah, the huddle. Yeah, and the transparency piece, being able to stand up and say, here's what folks are saying. What are we going to do about this?
Yeah.
Anything surprising come out of that transparency? And
people, we just started it in the last month. It took a while to get it framed, and we just started running it. We've had been about a month. We sure we want to put up this negative comment from a patient on there. And so what I'll coach back is, don't kid yourself. Those comments are being sent in the community. So we should be aware and know of them. And most people have gotten really positive. They're like, this is how you should, this is great.
Amazing. Well, Paari, thank you so much for joining the show.
Thank you so much. I really enjoyed being here.
Thanks for listening to the Land and Lead podcast. I'm your host, Dr. Josh Elmore. Tune in next time for more stories from leaders navigating high-stakes role transitions.